Hello friends. Now let us look at another question in our series MCQ for you. I'm Dr. Amit Desai and I take lectures in surgery for uh, FMGE and NEET PG. All right, so let's look at the question. The most common type of renal stone. Now they want to know the most common type of renal stone. What are the options that they've given? Calcium oxalate, uric acid stone, staghorn calculi, and cystine stone. Now, before we go for anything else, let us understand that staghorn calculi are mostly phosphate calculi. Staghorn calculi are mostly phosphate calculi. So which amongst these is the answer? Our answer is calcium oxalate. Okay, our answer is calcium oxalate. Now let us look at some of the common types of stones. Okay, let us look at some of the common type of stones that you find in the urinary system. That is urolithiasis. All right, and let us see some characteristic features of these. So, as we said, the most common type is the oxalate kind of stone. All right, it's the most common type. Now, how is this? It has an irregular surface. So, it is like a spiked kind of surface it will have. So, it has an irregular surface. Now, what happens because of this irregular surface is that because of this irregular surface, it is rough and what it does, it brushes against the mucosa, causing hematuria. Now, when there is hematuria, this blood that is there, it settles on the stone, and that is why the stone is a discolored, it's a blackish colored or a discolored kind of a stone that we have. All right. And this has got two types of crystals. It has got something called as monohydrate crystals, which are very hard and difficult to break by ESWL. The other ones are dihydrate crystals. Okay, so these are the types of crystals that we see in urine analysis. The other type of calculi that we see are the phosphate calculi. Just now we said phosphate calculi. All right. Now, how are they? These are smooth surfaced. These are smooth surfaced. All right. And what else is the characteristic? Because they are smooth surface, they don't have any bleeding usually, and so they are white in color. Sometimes we call it as dirty white in color, right? Now, imagine there is this stone, oxalate stone, which is causing a lot of hematuria. The moment there is hematuria, the person rushes to a doctor, gets investigated, and finds out that there is a calculus and gets treated. But in phosphate calculi, what happens is that because the surface is smooth, because they are nice and don't harm the don't harm the mucosa initially, what happens is that they grow to a large extent and staghorn calculi can be formed. So what do we mean by staghorn calculi? When calculi occupy the space of all the three calyces. So this is the kidney, this is one calyx, this is the other calyx, and this is the third calyx, and then it opens up into the pelvis. So if the stone or if the calculus occupies the shape of all the three calyces, so if it starts looking like this, like the horns of a stag, then it is called as a staghorn calculus. This is a complete staghorn calculus. If instead of three, if it occupies two of the calyces, then it will be called as an incomplete staghorn. Then it will be called as an incomplete staghorn calculus. Now, what are the other type of calculi? Another type is a urate calculus. Okay. And the characteristic of this calculus is that this is radiolucent, which means that we will not be able to see this on a plain X-ray. Remember, 90% of urinary calculi are radio opaque, which means that we'll be seeing them on X-ray, whereas only 10% of the urinary calculi are radiolucent. That means we cannot see them in the X-ray. It is associated with hyperuricemia, okay, which you see in a condition called as gout. It is associated with hyperuricemia. And usually, how are they? They are yellow or reddish or brown in color. Then we have something called as cystine calculi. Cystine calculi. And these are associated with cystinuria. Cystinuria, biochemical condition called as cystinuria. Now, these are sulfur containing calculi. And so they are hard. Right? So they are hard. So this summarizes some of the characteristics of the calculi, and the commonest one being calcium oxalate. If you liked this video, please subscribe to our channel ADSL Academics. All right, and please press the like button and also the bell icon so that you will get to know all the other videos that we are sending from time to time. Thank you very much.